When it comes to our health, there's one thing we all dread: medical tests. The mere thought of them can send shivers down our spines. But what if I told you that a simple test can reveal a serious condition that affects millions of people worldwide? This condition is diabetes, and the test is a blood glucose test. It's a straightforward procedure that can be done in a matter of minutes, but it can have a significant impact on our lives. For many of us, the fear of medical tests is rooted in the unknown. We worry about what the results might show, and how it could change our lives. But the truth is, knowledge is power. Knowing our blood glucose levels can help us take control of our health, and make informed decisions about our lifestyle. So, let's break down what this test entails. A blood glucose test measures the amount of glucose in our blood. Glucose is a type of sugar that our body uses for energy, and it's normally regulated by a hormone called insulin. When we eat, our body breaks down the carbohydrates into glucose, which is then absorbed into the bloodstream. The insulin helps to facilitate the entry of glucose into our cells, where it's used for energy. But in people with diabetes, the body either doesn't produce enough insulin, or it's unable to use it effectively. As a result, the glucose builds up in the blood, leading to high blood sugar levels. One way to measure blood glucose levels is through a fasting glucose test. This test requires us to fast for at least 8 hours before the test, usually overnight. The idea behind this test is to measure our blood glucose levels when we haven't eaten for a while. This gives us a baseline reading of how our body regulates glucose when it's not being influenced by food. The results of this test can tell us a lot about our risk of developing diabetes. Another important test is the HbA1c test. This test measures the average level of glucose in our blood over the past 2 to 3 months. It does this by looking at the amount of glucose that's attached to our red blood cells. The HbA1c test is a great way to get a snapshot of our blood glucose levels over time, rather than just at a single point. So, what do the numbers mean? A normal fasting glucose level is typically below 100 mg per deciliter. If our level is between 100 and 125, we may be at risk of developing diabetes, and if it's 126 or higher, we may have diabetes. For the HbA1c test, a normal level is typically below 5.7%. If our level is between 5.7 and 6.4%, we may be at risk, and if it's 6.5% or higher, we may have diabetes. Understanding these numbers is crucial, because it can help us make informed decisions about our health. For example, if we have a high fasting glucose level, we may need to make lifestyle changes, such as eating a healthier diet, or getting more exercise. We may also need to take medication to help regulate our blood sugar levels. The numbers matter, because they can help us catch diabetes early, before it causes any serious damage. Early detection is key, because it can help us prevent complications, such as heart disease, kidney damage, and nerve damage. These complications can have a significant impact on our quality of life, and even our life expectancy. But even with the importance of early detection, many of us still fear getting diagnosed with diabetes. We worry about the lifestyle changes we'll need to make, and the potential complications. But the truth is, diabetes is a manageable condition. With the right treatment, and lifestyle changes, we can control our blood sugar levels, and prevent complications. We can still live a long and healthy life, even with diabetes. So, don't be afraid to get tested. Routine screening is essential, especially if we're at risk of developing diabetes. This includes people who are overweight, have a family history of diabetes, or are physically inactive. By getting tested, we can catch diabetes early, and take control of our health. And if we do get diagnosed, we can work with our healthcare provider to develop a treatment plan that's right for us. This may include medication, lifestyle changes, or a combination of both. The key is to monitor our blood sugar levels regularly, and make adjustments as needed. By doing so, we can control our diabetes and prevent complications. In conclusion, a simple blood glucose test can reveal a serious condition, but it's also a powerful tool for taking control of our health. By understanding our blood glucose levels, and what they mean, we can make informed decisions about our lifestyle, and catch diabetes early. So, don't be afraid to get tested, and don't be afraid of the diagnosis. With the right treatment, and lifestyle changes, we can control our diabetes, and live a long and healthy life. Thanks for watching, and if you want to learn more about diabetes, and other health topics, be sure to follow Easy Medics Daily for clear, life-saving medical knowledge. We'll see you in the next video.